lots of text that would actually. Hi, everyone, and sorry for the slightly delayed start. We're just having some technical difficulties, but we are excited to welcome you to the next lecture in the St. Luke's and Idaho Clinicians for Climate and Health lecture series on climate change and human health impacts. Today, we have an exciting talk with several speakers, both local and national, talking about the health benefits of trees. As a quick reminder, we have one more lecture left in this spring series. In May, we'll have a speaker on heat and its impacts on health, and a speaker from the city of Boise talking about what the city is doing to mitigate those impacts here. I'm going to get right into it today because we've got several great speakers, and I want to give everybody a chance to get through their talk. Our first speaker is a good friend and colleague, a fellow board member on the Idaho Clinicians for Climate and Health, the owner of the Keystone Concept Consulting Company, and executive director of the Treasure Valley Canopy Network, Lance Davisson. Our speaker to follow him will be Dr. Geoffrey Donovan. Dr. Donovan is a PhD in forest economics from Colorado State University. Lance, there we go. He's a research scientist, advancing foundational research on the benefits of urban trees and links to human health. Jeff will be followed by Vivek Shandas. Vivek is a professor of geography at Portland State University and an advisor to Kappa Strategies, a global consulting firm working at the intersection of climate change, urban green space, and social justice. And then Ginger McCabe from St. Luke's, our executive sponsor for the environmental sustainability team, will be discussing St. Luke's and our healthcare tree campus Arbor Day pledge. So I'm going to turn things over to Lance and let him take things from here.
Thank you very much, Ethan. So I'm going to start from the perspective of the Treasure Valley Canopy Network. I'm excited to have the opportunity to talk with you all today. I don't know who all is in the audience, but I have a feeling it is a lot of clinicians and hopefully a lot of people that are interested in urban forestry and nature-based climate solutions. So we'll roll right into it. Today, what we want to do is share with you a little bit about what our nonprofit is doing in the theme of climate and nature and health, what we're doing with St. Luke's, and then also some of the solutions that we're trying to bring across the state of Idaho. We're also going to learn from some close colleagues and friends of mine, Vivek Shandas and Geoff Donovan, who are doing really cutting-edge research around climate and human health. And then we also want to provide an opportunity for dialogue. So let's dive on into it. The Treasure Valley Canopy Network is a 501c3 nonprofit organization. We've been doing this work for a little over 10 years in the Treasure Valley of Idaho. The Treasure Valley is basically the Boise metro area for those of you that don't live in Idaho. And there's three key tenets to our mission. We are an organization that plans for, plant, and grows trees across the Treasure Valley region, but we do it in the way of collaborating with others to bring solutions. We try to be really innovative, and that's why we've met both Vivek and Geoffrey. And so I'm excited for you to learn from them. And everything that we do, we are focused on building sustainable partnerships and also long-term sustainable solutions to green space in our communities. So it's a little unique and different. If you live in another part of the country and you work with a tree nonprofit, we're most likely a little different than the traditional tree nonprofit around the country. What was fun about how we started was we really started to gain momentum around the time in 2011, 2012, when the economy started to turn around in the Treasure Valley. So we did an urban tree canopy assessment back then. We learned the benefits of trees for air quality, water quality, carbon sequestration, and that has been our foundation. As the city has grown, so have we grown. We became a 501c3 just 3 years ago. If you have heard of the City of Trees Challenge, that is one of our most successful initiatives that came when City Council President of Boise, Elaine Clegg, said we're going to plant 1 tree for every household in Boise. That's 100,000 trees. And we are going to plant 1 forest seedling for every resident. That's 235,000 forest seedlings in Boise National Forest. That has really kind of launched our programming, and we have really become natural climate solution partners all throughout the Treasure Valley. So it's been fun, and we're really kind of exploding our programming now across the Treasure Valley. We're really focused on building public and private partnerships to bring solutions and impact. So if you look at the left of the slide here, energy conservation was our first success story with Idaho Power. That continues today. Then we started to get really involved in green stormwater infrastructure, which still continues today. About 8 years ago, we got into the game of kind of climate solutions, did some urban heat mapping with Vivek and his team, and we actually have city forest credits. We are selling carbon credits on trees that have been planted around the community of Boise. And so again, very innovative and kind of cutting edge in what we do. And then now we're really focused on reclaiming trees that must come down. We have the City of Trees Challenge, and then we also are working with St. Luke's in the health realm. I'd encourage you all, as you're traveling about, to think of trees in a different context after our talk today. Explore the urban forest and the benefits that it brings. Trees are cool. We're going to talk to you a lot more about what that looks like. And also, trees are living infrastructure. They're more than simply what looks pretty in our cities and towns. They deliver immense benefits across our communities. So I'm really excited that we were able to get Geoffrey in here. Sorry for the technical difficulties, Jeff. I am going to turn it over to you. Take it away.
Thank you very much. So what I'm here to do is to briefly talk about 3 of my studies on the association between trees and improved public health outcomes. Now, my purpose in talking about these 3 studies is to try and convince you all of 2 things. I want you to take 2 things away from this talk. First, trees can quite literally be a matter of life and death. Second, given that they can be a matter of life and death, we should treat trees as an essential part of our public health infrastructure. So I've got limited time, so I'm just going to jump straight into talking about the first study, which I did back in 2011, and it looked at the association between trees and birth outcomes. So why on earth would I choose to focus on birth outcomes? Well, first, there's a statutory requirement to report births, so the data are reasonably good. And, this type of work I do is very data hungry. And second, there is, and this is extremely important, there are several plausible mechanisms linking trees and improved health outcomes. So, for example, we know that stress is a factor for adverse birth outcomes. Absolutely. But we also know that if you take people and put them in the woods, next slide, then their markers of stress will go down. In addition, we know that exposure to air pollution is a risk factor for adverse birth outcomes. But we also know that trees can absorb air pollution. So and then finally, we know that exposure to high temperatures is absolutely a risk factor for adverse birth outcomes. And Vivek is going to talk in more detail in a moment about how trees can moderate temperatures. So let's get to the specifics of the studies. There was just under 6,000 live births that happened to women in Portland in 2006 and 2007. And I looked at 2 adverse birth outcomes. That's small for gestational age births, just was the baby born below the 10th percentile based on their gestational age and gender, and then just preterm, were they born before 37 weeks? Now, even the most ardent tree advocates are not going to suggest that trees are the only or even the main driver of birth outcomes. So we controlled for a wide range of demographic and environmental variables that previous research had found to be associated with birth outcomes. And only after controlling for all that stuff, we looked at, and this slide will show you, we looked at tree cover in 50, 100, and 200 meter buffers around the centroid of each house's lot. So on the left, you have a high resolution aerial photograph of Portland. And these, for privacy reasons, aren't women in the actual study. As you have the green rectangles, that's a woman's lot. And then the red dot there is the centroid. And then on the right, you have what we call classified aerial imagery. So you break that photograph into 1 meter pixels, and then using a computer algorithm, you code that as either tree canopy, that's green, or non-tree canopy, that's the sort of off-white. And just for clarity, I've only included the 50-meter buffers there in this picture. So bottom line, what did we find? We found that canopy cover within women who had more canopy cover within 50 meters of their homes were less likely to have underweight babies. And there was no impact on the likelihood of preterm births. So this is, kind of an interesting finding. But maybe to some of you, it may say, well, this is just a statistical oddity. And that's really not the worst explanation, because back in 2011, this was the first study to look at the natural environment and birth outcomes. But since then, over 30 studies have found a relationship between exposure, maternal exposure to the natural environment, and increased birth weight. So certainly one study can be a statistical oddity, but the likelihood of 30 being so is much less. Now, to be clear, these are associations. And it gets to the link between trees and birth outcomes is interesting, certainly, but it also highlights one of the biggest headaches when you're studying the health benefits of trees. That is what I call the nice tree, nice neighborhood effect, which I'm sure you're all familiar with. That is, in urban areas, neighborhoods with more trees are going to tend to be wealthier, whiter, and better educated. And we absolutely know that income, race, and education are major drivers of health outcomes. Now, in my work and then in those other studies as well, you try and account for these things the best you can, but you are left with that gnawing stomachache that won't quite go away. You're not quite sure if you've considered everything. And about 10 years ago, I was particularly bothered by this problem when I realized I could flip my hypothesis on its head. That is, if trees are good for you, which is what I believe, then killing them should be bad for you. Okay, well, why is that such a grand revelation? Well, because it opens up some new methodological approaches, because trees can die a lot quicker than they can grow. So you can longitudinally study changes in tree cover in a relatively short amount of time. Trees take decades to grow. They can essentially die instantaneously. So you can see this significant, large change in a short amount of time, and you can see the effect it has. So what this is a unique opportunity and a valuable one to sidestep the nice tree, nice neighborhood effect. Because certainly in the birth outcome study, for example, at one point in time, tree cover is absolutely correlated with income, race, education. There's no getting around that. However, tree loss over time need not be correlated with these drivers of health. So if you can find a longitudinal thing, a thing that kills trees over time that isn't correlated with those drivers of health, now you're onto something. However, whatever that is, you need a lot of trees to die in a short amount of time if you're going to have a measurable impact on health. Not a few trees dying here or there isn't going to do it. So what could kill a lot of trees in a short amount of time? Well, this handsome little gentleman on the screen there could do it. That is a little bug that you, unfortunately, in Idaho, you're going to know more about soon. It's the emerald ash borer. And in the US, in the last 20 years, it's been the nastiest tree pest. So to give you an idea of what it could do, we'll look at the next slide. And that is a tree-lined street in Toledo, Ohio in 2006. Let's see what happened 3 years later. Yeah, it's pretty devastating. It kills all 22 species of North American ash, and it'll kill all untreated trees. And the next slide here will show you how it spread. Started in Detroit in 2002, and it spreads outwards. Now, as you're watching this spread rate, what I'd ask you to imagine is, can you think of a demographic variable like race or education or income? Can you imagine one of those demographic variables changing in a way that mimics this pattern? Not really, because income doesn't change this way. Racial composition of counties don't change this way. So you have this unique pattern of tree loss, and it's a valuable thing to study. But what health outcomes could be affected by this type of tree loss? I chose to look at two, cardiovascular disease and lower respiratory disease. And I chose those for two reasons. Well, first, they're very important causes of mortality. Obviously, you're all aware of that. They're the first and third biggest killers in the US. And second, and again, this is very important, there are several plausible mechanisms linking both diseases with trees. So we have stress, we have air pollution, physical activity, even social cohesion, and of course, extreme temperatures. Now, in this case, we chose to look at mortality. And in the last slide there, you saw the black squares were the counties. We chose to look at county level mortality from 1990 through 2007. So you have this long run-in period without the bug, then you add it and you see what happens. And what did we find? Well, we found that when counties became infested with emerald ash borer, there was higher rates of cardiovascular and lower respiratory mortality. And what was interesting here is as more trees died, as the infestation progressed, we saw more people dying. So actually saw a dose-response relationship. More trees die, and then more people die. And across 6 years and 15 states, we saw an additional 15,000 deaths from cardiovascular disease and 6,000 from lower respiratory disease. So an additional 21,000 deaths, this is not a trivial number. Now, I think the results from the EAB study are compelling. Obviously, I'm hardly unbiased in this respect. But in the years since I did the study, I've wondered whether the opposite was true. That is, if tree loss is associated with increased mortality, which is what we found in the EAB case, then is planting trees, would that be associated with decreased mortality? One would think so. If you see it go in one direction, you would expect to see it going in the other. But that's fine. But to do a study like that, you'd need many years, I mean, decades of tree planting data. As I talked about earlier, trees take a lot longer to grow than they do to die. And I just didn't have decades of tree planting data. And then a couple of years ago, I was talking to a colleague of mine who works for a nonprofit in Portland called Not Friends of Trees. And just in passing, she mentioned, oh yeah, we've got records where we planted 50,000 street and yard trees since 1990. They had the address, they had the date where they planted all these trees. It was fantastic. And they were kind enough to give me access to that. Now, obviously, then I need health data to go along with that. So I contacted the Oregon Health Authority and I got access to census tract level mortality data. And for those of you who aren't familiar, census tracts are just a geographic unit used by the US Census. In Portland, which has a population of 600,000, there are about 140. So you can think of them as roughly the size of a named neighborhood. So what we're doing here is we're just looking at neighborhood level mortality. And we looked at two tree variables. We looked in a neighborhood and we said how many trees have been planted in the last 15 years, just overall. And then we also looked at the number of trees planted in 3 age bands. That's 1 to 5 years ago, 6 to 10 years ago, and 11 to 15. Why would we do that? Well, because a priori, we would expect that as trees age and grow, they would have a bigger impact on health. Think about what Vivek's going to talk about and temperature. Would you expect a 1-year-old tree to have the same shade as a 15-year-old tree? Obviously not. You would expect that to get bigger as they got older. And if we didn't see that, then maybe we have a problem with our fundamental hypothesis. So here I looked at non-accidental mortality, neighborhood level non-accidental mortality. It's typical to put accidental death out because there's no plausible way that trees are going to affect that. So this table here just shows you, it's a very simple model. We had found 5 variables were associated with non-accidental mortality. Let's look at the non-tree one first. As you can see, we found that neighborhoods with higher income had lower mortality. Not surprising, we see this all the time. Next one, we found that neighborhoods that had older populations had higher mortality. Again, hardly surprising, a little upsetting for those of us who are aging, but nonetheless true. Next, we found that neighborhoods with higher rates of education had lower mortality. Again, not surprising. So race was an interesting one. Here we found it was not significant. There are a number of specific reasons in Portland why that might be the case. One, Portland is a very white city, so we just don't have a lot of variation. And 2, we already have income and education in the model, so that might account for it. So now we have a drum roll. What about tree planting in the last 5 years? There you see, we saw that neighborhoods that had more trees planted in the last 15 years had significantly lower rates of non-accidental mortality. But is that, okay, it's statistically significant, but is this impact big enough to care about? And the next slide will show us. What we found is, on average, Friends of Trees planted 1,638 trees a year. So I used our model to work out, well, how many fewer deaths is that associated with? And we found go back to the previous slide, we found that was 15.6 fewer deaths. So that's quite a lot in a city of 100,000. Roughly speaking, we found that it was associated with every 100 trees planted was associated with one fewer death. So not a trivial number. So in the next slide, what we see is, well, what happens as trees aged and grow? So we just take those 1,638 trees and let's first see how many deaths are averted 1 to 5 years after planting. 11.6. Interesting. Now what happens when these trees age another 5 years? They're associated with 19.7 fewer deaths. So it's going up. And let's see those 638 trees 11 to 15 years later, 23.1. So as trees age and grow, they're having a bigger impact on health. It shows us that yes, tree planting is important, but what's at least as important is retaining mature trees. You see this graph shows it gets bigger. So that's really all I have time for. So I hope that in sharing my research, I've convinced you, of at least some of you anyway, that trees can quite literally be a matter of life and death, and we should be treating them as an essential part of our public health infrastructure. I should say also there are many more studies showing links between exposure to the natural environment and really a rapidly expanding list of health outcomes. I encourage you to take a look. If you have any questions about my work or the broader green health literature, please, there's my contact information. Please don't hesitate to contact me. And I will say in the last 30 seconds I have, as I'm an economist by training, in that tree planting study, I also did a cost-benefit analysis comparing the health benefits to the cost of trees. And I won't go into the details of it, but what I found is that the benefit cost ratio of tree planting was 1,727 to 1. So, human life is valuable, trees are cheap, let's get some in the ground. That's all I have time for.
I love it. Thank you very much, Geoffrey. And I'm excited for us hopefully have some time at the end to ask you some questions. I encourage you to save that email and follow up with Geoffrey as well. Very fascinating research that supports all the work that we do. So thank you very much. Let's go to Vivek. Take it away, sir.
Okay, I'm hoping you can hear me okay.
Yep.
Okay, great. Well, it's often, I find, very difficult to follow Geoffrey. Very astute, carefully done research, very compelling results. And I'll say it's very hard to also follow pictures of a cute puppy that is in many different postures, seem to be in deep contemplation, probably thinking about the results of Geoffrey's study. Yes. Thanks, Geoffrey, and thanks, Lance, and the whole team at St. Luke's for putting this together. You don't know much about me, but I'll just start with what is inspiring me to contribute to this temperature, trees, and human health work. And it really does come down to the big question of what have urban forests done for me lately as a child of the 80s. And listening to a lot of popular music, this was something that I listened to and then realized that, it is about urban forests. And for me, what have they done for me lately and characterizing it? So in my career at Portland State and advising that I do, some of the earliest work that I did was to really start looking at the relationship between trees and air pollution. And we wanted to find a way to make this compelling to folks. And so part of what we're trying to do is assemble a set of literature and a set of analyses that would quantify the amount of impact that air pollution had on human health. So we were able to look at the Portland metro region with a very dense amount of air pollutant measurements that we did, arguably the most that's been done around the country in a urban environment. And we were able to quantify that the existing tree canopy, as the punchline, it contributes about $4.5 million a year in healthcare costs, or reduction in healthcare costs for the city of Portland, Oregon. And that was something that got us into another round of work that came a few years later that really focused on how do we think about the relationship, not just of air pollution, which we know is a direct contributor to human health, asthma, COPD, wheeze, etc., but also looking at the relationship between temperature and health. And so we spent quite a bit of time looking at the relationship between temperature and trees. And now we've done this across the entire country in over 100 cities where we've done mapping like we did in Boise, which I'll talk about in a minute, and Nampa as well. And looking at what role trees play. And we were able to kind of come to a bottom line of about 20 degrees Fahrenheit. It varies in neighborhoods, of course, but on average, that's what we're seeing in a high canopied neighborhood versus a low canopy or no canopied neighborhood at a range of about 40 degrees. And emerging work that we started to move into that based on some of this heat mapping that we've done. This is a map of the city of Portland where I live, and the hotter areas are red, the bluer areas are cool, and we're able to take several 100,000 birth records, very similar, following Geoffrey's work, and look at the relationship between gestational age, gestational weight, and the presence of urban heat islands. And we were able to see that depending on where you lived in the city, there was a signal that we were able to pick up through odds ratios about 53 grams being affected in terms of where in a specific location, specifically in urban and hotter, more extreme heat environments, mothers were often birthing babies that had a difference of about 53 grams. And that was something of noticeable to us. And right then, a national study came out corroborating some of these results as well. So when we take these three together and we transition into what we now see and call the climate age, where we are seeing some serious destabilization of temperatures, the built environment that we've put together in our cities, in our neighborhoods, the communities that are disproportionately affected, and this kind of future projection of what we see coming is something that's got these previous studies really on alert, because we really need to be able to assemble the vast amount of knowledge to know what are the most cost-effective and direct ways to support human health in the communities we live in. And so if any of you were around in 2021 in June, when this monster of a heat dome came through the region, we were just completely caught aback, because this just sent hospitals kind of reeling in terms of hospitalizations. And Boise and much of Idaho were on the kind of later end of this. It did come through Idaho, and we did see impacts as I was working on the National Climate Assessment. We were seeing impacts in Idaho as well. Though this is kind of a regional synoptic perspective of heat-related emergency department visits that just spiked. That led us to getting a better understanding for where are those deaths happening, again, in the place I'm really familiar with and I kind of want to drill down into. And so we worked with the Oregon medical examiners and mapped at a census block group and tract level where all the deaths had occurred as a result of this heat wave that came through. And they mapped pretty closely. If you will notice the little red polygons on the map on the left, they're mapped pretty closely to where we saw the highest proportion of deaths occur. And this is not rocket science in that sense. Places that are hot, places where communities have less coping capacity, we likely see greater number of deaths during heat waves. In fact, heat waves claim more lives than any other natural hazard. So this is really something we're watching. And there's a little bit more salt on the wound, because this was a map, the one on the left that I produced in 2016, and the map on the right was something produced in 2021. And we knew that there were going to be places that were disproportionately impacted and communities that were going to die as a result of heat. And this was a way for us to kind of characterize it. And as I was saying, there's a little more salt on the wound when you look at where are we seeing tree canopy loss across the city in this case. And in this case, the darker purple represents the places that had lost the greatest number of trees between the years of 2014 and 2022. And that was right around when all these trees were being lost, is when this heat dome showed up, and where there were already communities struggling with hotter temperatures, already struggling with coping with those hotter temperatures. And at the same time, we're seeing a reduction in the overall tree canopy in those same neighborhoods. So we're seeing an amplification of those temperatures in those locations. And if you don't believe these maps, then let me show you some satellite imagery, and I'll kind of go through these relatively quickly. Just at 2014 to 2019, we're seeing Amazon warehouses show up. That's a big arrival into many of our regions. That's really changing the tree canopy. We're seeing neighborhoods transform from having lush canopy to a lot more multifamily, single-family housing. So development is really driving a lot of these pressures. If we keep going through these, you'll see that, you know, even places that are relatively have a robust forest, a grove of trees are being lost to slated development. And this is something that's playing out even in already urbanized areas, such as you see on this slide. And then, of course, neighborhoods, smaller neighborhoods that are slated for development. This is much of the east side of Portland. So we took a deep step back after seeing these results and wanted to see, is this a pattern we're seeing across the country? So using satellite-derived data and a series of heat maps, air temperature maps that we've created for Boise and Nampa, but also created for these other 33 cities, we look to see where are we seeing the greatest loss of trees. And despite the trends that are happening in Washington, D.C., for example, Atlanta and Jackson, on the right side, we see the majority of the cities we looked at losing tree canopy. That's the orange line that's going down in this graph. And so while there are a lot of efforts like Friends of Trees that Geoffrey's talking about that are planting trees, what we're observing is actually an overall decline in tree canopy occurring in our cities when we look at least this sample set. It gets a little bit more intense when we look at where those trees are being lost. And I know it's right before lunch. You're probably losing some concentration looking at graphs this dense, but let me just walk you through this really quickly as my last couple of slides here. The map or the graph on the right, and these graphs actually depict on the left side neighborhoods that have lost trees, gained trees, and stayed the same. What we're seeing here is those areas that gain trees are actually in the blue color, if you look at those really closely. So those are the areas that, those are the percentage that has gained trees. There's a percentage that have lost trees that are, lost trees are in blue, the gained trees are in orange, and the no change is in gray. Follow me with that. Lost trees are in blue, gained is in orange, and no change is gray. And when you look at Boise and Nampa, really interesting, both have lost a fair amount of trees in the hottest neighborhoods. That's the graph on the right. The graph on the left are the coolest neighborhoods in those places. And what we're observing from these two graphs is that hotter neighborhoods are actually losing proportionally a larger number of trees than they're gaining. And so this is a trend we're seeing across the country in pretty consistently, which adds a little bit of sourness to this soup because it is something that we're trying to address head on. So this is an example of a place where we are trying to address this head on, is in Los Angeles. And people say that if you can green Los Angeles, you can green any city. So we're actively working with the city, with nonprofits, with various other sectors to develop these urban forest equity guidebooks and assessments, which essentially create a three-tier system where we're saying in tier 1, you can plant trees very quickly in these locations. In tier 2, it's going to require a little bit more physical changing of the landscape to be able to get trees in. And in tier 3, you're going to potentially require some policy changes along with physical changes to the landscape to be able to systematically get trees in the ground. And we have various examples that we put forward as to ways the investments that you're putting in can actually translate into greening. So it's been an incredible, deep 3-year project that we've been working on with many different communities in Los Angeles and a couple of reports. The last one I just want to touch on is a project I'm actually going to, in about 10 minutes, getting on a plane to go to Jackson, Mississippi, to continue with this project where we're working with a historically Black African-American corridor, Fair Street, and using it as a very specific case example for how do you do greening with the community that has been historically disinvested and really marginalized. This used to be a very robust center of activity, and it's been gutted over the years. So we're really trying to bring some attention to what are the places where greening can also support economic development, can also respond to cultural thriving in that space with outdoor venues, music spaces, et cetera. So we're doing a lot of monitoring, a lot of surveying, a lot of sketching out of this neighborhood. So I'll close with my last slide in just noting 5 things about the current state of trees and health and trying to move towards that agenda. We do see that we need the science behind this. Geoffrey was very poignant in making that case. The health sector is conspicuously absent right now in terms of what we're seeing of who's involved. Acute events are on the rise, and we're seeing communities die unnecessarily as a result. And of course, we need to build these integrated approaches to being able to do this work. And I like to really highlight examples to be able to show that this work can be done. So in closing, let me just say, we'll do this together, and let's go. Thank you for your attention. Appreciate the opportunity.
Thank you so much, Vivek. And I'm excited that you were able to join us before you hop off to Mississippi. Like I mentioned, Vivek has been a huge help to us and the urban heat data that we're able to use. And we're working on other ways to work more and more with both Vivek and Geoffrey to support what we're doing in Idaho. So thank you both for all that information. We're going to hop over now to Ginger to talk a little bit about what we're working with St. Luke's on. Is Ginger with us today?
I sure am. Can you hear me okay?
Excellent. Go for it, Ginger. Thank you.
Excellent. Well, thank you to Geoffrey and Vivek for sharing with us really the importance of trees, not only on our communities, but on our health. And as you heard, I'm going to spend just a few quick minutes talking about what we're doing here at St. Luke's. So first of all, you've heard St. Luke's Health System is here in the state of Idaho, and I'm presenting today from Boise, our capital city, which is also known as the City of Trees. In fact, across the St. Luke's footprint, the majority of our facilities and clinics are in areas that have been designated as Tree City USAs. So what we wanted to do was understand how we might be able to leverage the Tree Campus Healthcare Foundation program to support the work that we're doing here at St. Luke's. So in my role here at St. Luke's, I have the opportunity to support what I call our very small but very mighty environmental sustainability team, led operationally by Stephanie Wicks and clinically by Dr. Sims. And the first thing Stephanie and Dr. Sims did was realize, wow, we're already doing this work at St. Luke's. As you heard me say, we're already in areas that are designated tree cities. So we've got a lot of trees on our properties already that we're accountable for taking care of. But we're doing it really kind of passively and in a reactionary way. So Stephanie realized, man, we can leverage the foundation program and framework to be intentional about this work. So the first thing she did was talk with a few internal stakeholders here at St. Luke's, members of our facilities team, our building services team, finance got engaged as well to help us understand what we were already doing. And as a result of that analysis, determined that our best opportunity really was in our downtown campus around our Boise hospital, again, to leverage the work that was already happening in that space and really be intentional about the care and support of the trees on that campus. So we added to that internal team, developed some really great community partnerships with Treasure Valley Tree Canopy, the City of Boise, the Idaho Department of Lands, and in collaboration with Boise State University, put a project together to do a full inventory of all of the trees across our Boise campus. And that was completed in October. And that helped us establish some really good metrics around our carbon storage, around air quality, and around stormwater runoff, et cetera. So we were able to put those metrics in place in October. At this point in time, we are working on putting all of that together and developing a plan to make sure that we're sustainable in that tree canopy in our downtown Boise campus. And hopefully we'll apply our and be successful when we submit our application to the Arbor Day for our tree campus healthcare designation. So next steps here up on the slide, we are developing that Boise Hospital campus tree maintenance plan, working on submitting that application, and again, tracking the financial investment intentionally and being able to report that out as well. And then educating as well, hoping that this work that we do as a pilot in our Boise campus will be able to be replicated across our footprint and help us, again, be really intentional about the management of this resource that we've been entrusted with.
Thank you very much, Ginger. And I really have, thank you so much to St. Luke's and to ICCH for hosting this conversation. And Ginger and all the leadership at St. Luke's has been so great to work with as a nonprofit that's trying to bring in all the knowledge and expertise of people like Vivek and Geoffrey to work together with both clinicians and hospital administrators to build healthy and thriving communities. And it's a great example of what we're doing on the St. Luke's Boise campus, how the hospital can lead by showing how you have thriving landscapes where the patients walk around, where the patients come to visit. And it's just, again, Ginger, thank you so much for that investment. And we're really excited to see what the future holds for our partnership.
So Lance,
and I will turn it over. Yep, yeah. I'll turn it over to you, Ethan. You tell me if you want me to keep the slide up or kick that off.
Yeah, just leave that slide up. I'm really proud of the work St. Luke's is doing in undertaking this journey to become a tree campus healthcare designee with the Arbor Day Foundation. In addition to all of the many studies that Geoffrey and Vivek pointed out, there are lots of other studies that look at things like discharge rates from the hospital, complications associated with surgery that show that if you can see a tree from your window, you have a shorter hospital stay and less risk of a complication from surgery. And that may not seem like something that is intuitive, but green spaces have tremendous therapeutic benefits. And I think we don't understand it. And it's work from people like Vivek and Geoffrey that really have driven some of this knowledge and let us see that. Before we get too far and we lose Vivek, I just want to know if I can call him Miss Jackson if I'm nasty.
But yeah, absolutely.
Okay, excellent. So this is a question that Lance and I have discussed previously and sort of a pet peeve of mine. If you look at that picture of Boise up on the slide, you see those barren foothills behind us. And that may be our natural state, that we're a high desert environment that has, does not have a typical forested foothill leading up to the mountains. But I have looked at that space since we've been here and thought that, that is the lung of Boise that we haven't planted yet. And so my question is always, can we go in and forest or reforest an area like that doesn't get a lot of precipitation, but would provide a ton of health benefits if we forested that area? Or is that unnatural intervention something that is not realistic and not a sustainable process? And I think any of you guys could answer that. Maybe Lance, since it's more a technical tree question.
Sure, yeah. There are a number of different efforts in the Boise front. There's a few things that we look at. Is one, like Ethan said, it is a high desert environment. Not only is there a challenge with trying to grow trees, but also in some of those areas, the trees are so dense that fire is very devastating. So it's really a balance with the natural environment. What we'll often do in these open space areas is if there's water, if there's a drainage and there's a chance to do some reforestation in there, usually that's the best place in the desert to do it. In the other areas, there might be opportunities to plant some places, thin trees other places, so they're more healthy. But we rely really on looking at what nature brings us and then also bringing in some interventions when the time is right. When you pop down to the valley here where we're at, this is what we call an urban forest. So in this area, we can be a little more creative, but we still have to balance our water use and make sure that water use to water those trees is worth the benefits that they're providing for clean air, clean water, reducing energy consumption. So it is a bit complex, but also we have the right experts to help make it work and make it happen. Do you want to add to that, Geoffrey?
Yeah, I mean, absolutely. I think it's so important to realize when we're working in an urban area, this isn't a natural environment, so having some goal of a forest that, creating a forest that would be there if the city wasn't there, I don't think is realistic. And I think, again, yes, water is an issue, but when you start to add up all the benefits that trees can provide, be their health, energy, crime, a whole load of benefits like that. Yeah, water is an issue, but the benefits are just so large that I think it can be dealt with. I don't think I was talking to Lance a couple of days ago, and I was saying, maybe if I really tried hard and thought of a particular circumstance, you could come up with a way in which the costs of planting a tree are greater than the benefits, but you'd have to work extremely hard. I think we're past the point now where we know that the benefits exceed the costs in virtually all situations. So I just think we need to get on with it.
Love it. Thanks, Geoffrey. Anything you'd like to add, Vivek?
No, I don't think so. I mean, that's more or less covered it really well.
Great.
Awesome. Thank you. And Vivek, you've got to run to the airport, right? So do we have you till the top of the hour, or do you have to bump early?
Yeah, I'll keep my video off because I've transitioned to my phone, but yeah, I'm here. I'm listening in and enthusiastically raising my fist in support.
Excellent. Thanks, Vivek. Ethan, do we have some more questions?
Yes. With the lag between tree planting times and the maximal benefits of a robust tree canopy, are there other natural-based solutions we can use to decrease heat and mortality? And to kind of follow up with that, does it make sense to focus on the fastest growing tree species to maximize the time to that dense urban canopy? Or is it really more important to focus on native tree species than rapidly growing trees?
That's a good loaded question. Vivek, do you want to try to tackle the first part of that? I'm assuming that the first part of that question was a tree takes a long time to grow, right? So it's going to be 10 to 15 years before that tree starts to show those benefits. What can we do, possibly artificially or with other strategies before that tree's big enough? Was that the first question, Ethan?
Yep. Yes.
Vivek, do you have some ideas from your urban heat work?
Yeah. What we found is we kind of use this. There's an old adage of kind of a wedge method where you're talking about multiple slices that have to be kind of put together of interventions that help in addressing the heat impacts. Trees are one massive slice of that pie in terms of being able to directly drive cooling, which then translates to effects on health. And so there's that piece. There's more immediate interventions that have to be taken in addition when it comes to heat. I mean, we're talking about low cost. I'm really interested in low cost, highly impactful work. There's a tool which I would love to create at some point with the help of a lot of medical professionals that really focuses on kind of if you live in a specific area and you're likely going to be an urban heat island, can a clinician quickly look at that zip code, look at that even street address and say, how are you coping? Do you have friends, family, network, neighbors in your environment immediately around you that can help, that you can rely on for cooling off during those hot days? Do you have access to air conditioning? Can you run your air conditioning? Do you have resources to be able to run your AC on days that go above 85? I'll just note that on a side note, currently there's not many municipalities, not many at all across the U.S. that actually have a heat temperature threshold for indoor spaces. So an indoor space can go up to 140 degrees Fahrenheit and it can still be a legal thing, whereas it can't go below 65 degrees, at least without a heater in place. So heat is one of those things where the shade from a tree, where other interventions of, whether it be buddy programs or finding cooling cooling options through cooling centers from the public health agencies, et cetera, are direct things that I would hope clinicians and others are able to direct people towards. There's a pretty long list. We just wrote a piece in Health Journal about actions that can be taken short, medium, and long term. Happy to circulate that around after the chat as well.
Yeah, that would be great.
That's great, Vivek. I think that's the other thing, Ethan. Are we able to follow up kind of with an e-blast of resources and our contact information afterward?
Absolutely.
Perfect. Geoffrey, do you want to add to that conversation? The second piece of that, I think Vivek answered the first part big, was that do you do fast growing trees just to get fast trees up? Does that make sense?
Yes, it does. I don't think you sacrifice everything for a fast growing tree, but you're absolutely right. You know, benefits to happen quicker are more valuable. So yes, I think it is good to have a mix that can't be the only criteria, but absolutely that was something you should think about when how quickly you can get a tree to a size where it's going to start to provide benefits. So yes, I mean, imagine if you were doing an intervention at let's say an assisted living home for older people, planting redwoods that might take, or cedar trees, red cedar, kind of slow growing. It's probably not good. They're not, people who are 70 or 80 years old are probably not going to get that excited by that. So yes, fast growing is good.
Excellent. Thanks, Geoffrey. And to kind of add to that, you brought in the diversity piece. So a few threads to that before we go to the next question. Go ahead, Geoffrey.
Yeah, that's a whole thing. Well, we haven't talked about that is biodiversity. And one of the things I've just started to do some work here, that some of you may be familiar with the hygiene hypothesis, this notion that we need to exposure to bacteria and microbes for our immune systems to function properly. And trees and plants can play a big role in this. So I've got some research showing that if you're in kids are in a more biodiverse area, they're less likely to get asthma. That's for a fixed level of greenness, if that greenness is more biodiverse. I even have some work showing that kids who live in more biodiverse areas are less likely to get childhood leukemia. So this, the bacteria on the leaves of trees and plants can be extremely valuable. And obviously, the more diverse that is, the greater they're going to be. The other good thing about diverse trees and plants is they're less susceptible to invasive plants and insects. You don't want to have all ash trees and they're all going to go away, or all elm trees. So diversity is very important.
Great point. Great point. Do we have time for another question, Ethan?
Yes, indeed. So there's a question from the audience that said, in urban settings, trees are often next to or in grass or, grass lawns. How do fertilizers used in neighborhood lawns impact the health and longevity of trees?
That's a great question, and I'll take that, and then maybe if Jeff or Vivek want to build on it. Typically, the challenge in turf areas is people are treating the turf and they kind of forget about the fact that the tree has different demands. I am not a huge advocate of artificial fertilizers. When we plant trees, typically what we do is we try to plant the right tree in the right place for the right reason. And that tree in the Treasure Valley, you're going to need to water that tree. That's important. When you're looking at watering a tree that's in lawn, if you only water to meet the needs of the lawn, you're most likely not going to meet the needs of the tree. So a really simple thing to do is once or twice a week during the heat of the summer, run a sprinkler for longer under the tree so that the grass is meeting its needs and then water's getting down into the soil for the tree. But that is a typical challenge when you have turf and trees, is that you need to think of that tree's demands above and beyond just the turf's demands. Does that answer the question, Ethan?
Indeed. We have just a few minutes left, and I want to try to get through a few other questions. Are there benefits of other green spaces like green roofs, rooftop gardens, or even ground-based gardens that are similar to trees? Or is there something unique about trees besides just the shade canopy they provide that leads to more benefit? Like, should we be focusing open spaces on trees over gardens, or is green space alone enough?
That's a good question. I might let Vivek start on that one, and then Geoffrey and I can finish it off. And that's probably our last one. Vivek.
Yeah, I mean, we have spent a bit of empirical uh, assessments of green roofs on structures, commercial, multifamily, primarily, and we've seen that there is a reduction in temperature in those areas. And we've had a project some time ago putting solar along with green roofs to see, because solar panels are more effective when it's a cooler, and so those green roofs act as cooling for those solar panels, so you're able to generate electricity and keep it cooler and more effective, efficient when it's in that environment. So that was really interesting. And then in terms of other vegetation, one thing that's really coming up with a lot of planning code and things like that I'm working in is these building green walls that are showing up. And generally speaking, what that does is absorbing a lot of that sun's direct solar shortwave radiation, landing on those leaves on the green walls, that are then reducing the absorption of those dense, hard, like often concrete or other materials that make up. It's absorbing. The green is essentially, the living material is absorbing a lot of that heat before it can actually transmit to the material surface, which then ends up cooling the overall inside as well. So there's a lot of literature on kind of financial benefits of this green walls and green roofs in relation to end use. That's also been happening, that a lot of folks in California have worked on, and a few other places around the country. So yeah, many other benefits that you can kind of add together. And as Geoffrey and Lance have pointed out, lots of kind of co-benefits that when you aggregate them together make it pretty.
Well said, Vivek. Do you have anything to add to that, Jeff?
Yeah, I absolutely agree. Other vegetation can be valuable. It can, as Vivek said, you can be put places that trees can't. That said, size matters, particularly for health. So you have, imagine shade. Obviously, a bigger tree can provide more shade. Air pollution, that's just a function of leaf area. So I think, yes, others can, but trees, just because, they're the big part of them, they're just big, and big matters. So encourage you to do some tree planting as part of any greening effort.
Well said, Jeff.
Just one
I
last
think you
question
guys
from the
captured
audience.
it, Ethan.
One last question from the audience, and then I would love it if we could try. There's been a lot of interest in people for how can I get involved in helping at St. Luke's. I'd say reach out to us at sustainability@slhs.org. How can I get involved in my own home and in my community? And I think maybe Lance and Treasure Valley Canopy Network could give us some resources for that. And I think some links to some of these studies and other ideas would be a great opportunity from Jeff and Vivek. Some of the projects you're working on, how can we support those efforts? Because these are really, I never thought of controlling emerald ash borers as a healthcare intervention, but if you connect the dots, it sure is. And so I think one last question to ask you guys, do you know if there is funding from the Inflation Reduction Act for cities and nonprofit organizations to buy trees and to support this work?
That is a great question. And the Canopy Network received $1.1 million in Inflation Reduction Act funding to do this exact work in the Treasure Valley. So when you check out our website, and we can follow up with that information, we have a web page on how that funding is rolling out. So the answer is yes, yes, and yes. Locally, there's that $1.1 million we received. That's for all the Treasure Valley. The city of Nampa received IRA money. There are also several other Inflation Reduction grants being applied for that we're a part of. And it is one of the most exciting times right now with funding coming towards this kind of work. And our regional nonprofit is successful not only bringing that funding in, but getting it out and on the ground. So I would love to connect with anybody that's interested in helping us put that money in the place that it's needed most.
Great. Well, thank you for a really dynamic talk. I think you guys have given us the why for why we need that urban tree canopy, why trees are so important. I think there's a lot of other reasons out there, but I think, hearing you guys speak today, it is even more motivating to help take St. Luke's to this tree campus healthcare designation. And I think a lot of people are interested in helping support this work. So we'll send a follow-up email to all registered speakers with some links about how you can get involved both at work and in your community, and maybe some more information about that. And then join us for our next talk in May, which will be about heat itself and how heat impacts human health, and some efforts that are being taken here in the Treasure Valley to mitigate heat. So thank you to all our speakers. Thank you to all our attendees, and we'll see you in May.
Thank you, everybody. Take care.